Today's May 23rd, 2017. We're here with John. John's mother had what the doctors believe was a stroke, correct?
Yeah, minor stroke, they said.
Minor. However, when she came to me, she couldn't walk. She was in a wheelchair, correct?
Right.
She didn't respond to her name. She wasn't able to get up. And basically, she was unresponsive. She could sit in the wheelchair, and that was pretty much it, correct?
That's it. Yeah, she couldn't carry out activities of daily living at all. She was pretty helpless.
And she's been with us for 4 weeks now?
Since April 6th is when I brought her in.
Okay, so it's about 6 weeks.
Mm-hmm.
And she's been getting ozone therapy.
Right.
She's been getting essential phospholipids intravenously, minerals intravenously, glutathione. And tell us, I was shocked today. What's happened to her?
And she's been getting methylene blue.
And methylene blue, thank you very
Right.
much.
Yeah.
Methylene blue is a unique compound. It's an very old drug, extraordinarily safe, that seems to help rescue mitochondria and very good for brain. And tell us what's happened.
I've been bringing her in about twice a week, and then for the first 3 or 4 weeks, I brought her in twice a week, Tuesday and Thursday, and then I didn't notice that much difference. She had to bring her in a wheelchair. She couldn't walk. She was incontinent completely. Couldn't shower. Couldn't do anything at all. And then I cut it back to bringing her in once a week, and she was getting all those treatments you just described. And about 2 weeks ago, I noticed that she, on her own, got up from the dining room table
and walked. On her own.
On her own. And she slowly improved. She's gained strength, and now she can use the toilet. And I walked her in the office today without a wheelchair.
Oh my God. And I just went to talk to her now. She responds. She told me her name. She smiled, and she was very responsive. And I have to be honest with you. You even told me that when you first came in, I was not that hopeful.
No, she was in a wheelchair in your office. She was in diapers. I had already taken her to her regular doctor, an integrative doctor, and to a neurosurgeon who had installed a shunt in 2006 for her because she had that normal pressure hydrocephalus. But he looked at a CT scan and he said, hey, there's really not much we can do. It's just her age, and that's it.
So the conventional people wrote her off, said, do your last rites or whatever, nothing we can do, and
that's about it.
And you brought her here, and
right.
Now she's functional.
Now she's functional. And I want to add one thing. She does not take any prescription medications. In fact, she hasn't taken any prescription medications for years. And she, even to this day, even though they said she had a minor stroke, her face was droopy and everything, she had the symptoms, she's not taking any pharmaceuticals at all.
That's wonderful. And at 87, correct?
88.
Wow. Pharmaceuticals can be tough on people that age. And how's she doing continence-wise?
Well, like I said, now she tells me when she needs to go to the bathroom, and she can, handle that on her own. I just kind of help her, make sure she's not going to fall or anything. But
may I post this on YouTube?
Sure, you may.
Is it okay if I interview her as well?
It's fine. If this can help anybody else, I'm happy to.
Thank you so much. I think it can. I interviewed my own mother. My mom had an ophthalmic stroke, a visual stroke. And after we did ozone therapy on her, she ran around the parking lot like a little kid. I couldn't believe what I had seen.
That's amazing. Yeah.
Thanks very much.
Thank you.
Now, I didn't go ahead and say what you just said.
I came in here on April 6th. My mother, Mary, she's in a wheelchair, kind of like this, wearing a diaper, and you looked at her and we talked, and you said, hey, I can't promise anything, but we can try this, and this, and see what happens. So you were not hopeful at all, and I figured, hey, let's try, it's worth a shot. And my expectations weren't that great, but now I'm very pleased.
Thank you. You are a good son. And she's getting progressively better. Is that correct?
Yes, she's getting better, slowly but surely.
Wow. Thank you.
You're welcome.
We're saying about insurance, most people?
Most people wouldn't think of coming for this type of treatment because their insurance won't pay for it, and they feel that, well, we have to go and do what insurance is going to pay for.
Well, what good is insurance if it pays for things that don't work or make you worse?
It isn't good at all, and it's unfortunate that our system is set up like this, because we're sacrificing people's health, people's lives, just because of the system.
Because of the system. And here we got really good results, and insurance won't pay. But they'll certainly go pay for her to be a vegetable somewhere or get treatments and tests that amount to absolutely nothing.
That's about it.
Yeah, that's sad. I offered publicly to have a center where I was only paid if I got results. But I want to get paid exactly what they would pay the other guy if they got results. In other words, let's say you come to me with a bad knee and a knee replacement will cost $50,000 and I get you better for 3 treatments for like $800. Well, I'm willing not to get paid at all. But if I get you better and I spare that knee surgery, I should get paid the $50,000 that the insurance would pay. Does that not sound fair?
Sure.
You can say no, but it seems to me that insurance would want to do that too, because it doesn't cost them a penny out of pocket if I don't get them better. I would be willing to do that with just about anything, because generally we do get results. But insurance doesn't want to pay what they pay the other guys to fail. That's what's sad. John, thank you very much.
Thank you.
Hi, John said I can make a video of you. Is that okay?
Hi, Mom. How are you?
Fine. I'm fine.
Good.
You feeling good? You're smiling now. You know, when you first came to see us, you couldn't even look at me.
Oh,
You don't remember that, do you? No. You have done so well. I just am so pleased. Okay.
Mom, do you feel better? Are you feeling better? Do you feel better?
yeah, I feel better.
Good.
Yeah.
And you're getting up and walking now, correct?
Uh-huh.
All right.
Good, Mom.
Thank you, Mary.
Yeah, thank you.
What'd you say, ma'am?
Thank you.
And you're welcome. Today's date's 5/23/17. This is a patient who's been in my office, and he saw something today, and he wanted to share what he saw.
I saw a miracle today. Several weeks ago, a woman had come in a wheelchair and basically couldn't talk. And when I was in my treatment room today receiving treatment, I saw her walk in on her own without a wheelchair. And later this afternoon, I saw her talking.
And she had a verbal exchange with me too. Did you know that?
Yes, that's what, as I was walking by the room, I saw a verbal exchange. You were asking her questions and she could respond.
And there was no response when you first saw her. You remember that?
Yes, she was like a zombie.
Thank you very much. May I put this together with the other video I made to post it?
Yes.
Thank you.